Treatments for cystic fibrosis, they are obviously going to be on a lot of medications, antibiotics for infections, bronchodilators, corticosteroids. So if you think about the long-term use of these from childhood through adulthood, there's going to be many potential possibilities for problems. They often have to have chest physical therapy to loosen the mucus. This can either be done manually, or if you can see in the photo that they have a little vest that they wear that vibrates their chest. Pulmonary rehab can be indicated for persons with cystic fibrosis. So once again, it's not just, older adults who've been smokers who go to pulmonary rehab. As we mentioned previously, many people do need to have a lung transplant at some point. That might be their only chance of survival. Try to get antioxidants as much as possible, so high fruits and vegetables. And because cystic fibrosis is due to a defect in a gene, perhaps there can be gene therapy in the future where, maybe before birth the gene can be identified and people can have, surgery either before birth or after birth. But that is a long, long way off. Exercise testing in cystic fibrosis. If you've got very small children, you're really not going to be able to test them. Kids who are, early elementary years, you can use them on a treadmill. Most kids can walk, looking at their heart rate. Oximetry monitors the oxygen saturation. And kids who are older than that, you can use a treadmill or the cycle, but they have to be big enough to be able to reach the pedals on the cycle. So 2-minute stages, ECG monitoring, try to get 4 to 5 minutes at least of data. Make sure that there's oxygen and other emergency supplies. And these are typically going to be done in a hospital or a doctor setting, or potentially even a children's hospital, a pediatric pulmonologist. But overall, there aren't a lot of data on exercise testing and training in kids with cystic fibrosis to really make across-the-board recommendations. Exercise responses, they can increase their minute ventilation to get better ventilation to the alveoli. They actually can have normal VO2 levels, which is interesting. They are going to have a reduced exercise tolerance. They're probably going to develop dyspnea more easily than other kids. Important thing, they may drop their oxygen saturation. So we're probably not going to have these kids in our facilities or in schools, but they may need to be monitored with an oximeter. And they can increase their aerobic fitness. So kids, they should exercise, and they should try to exercise and increase their daily physical activity to as much as possible. I don't know if they're going to get to the 60 minutes per day, but it's always good to try to get kids as active as possible. Involve the family, social support, friends, family members. There may not be enough kids so that there can be a group exercise. Kids can potentially play some competitive sports. That would really be up to the physician. Diving, scuba diving, swim diving, try to encourage kids to be as active as normal. They can do resistance training. As you mentioned, they're going to be taking a lot of these medications. They may be taking prednisone, so they really should do that. And, the problem is adherence. These kids are sick a lot. So can they maintain an exercise program, enough sessions and enough adherence in order to really get the benefit? So we want to try to keep them active so that we can do that. Heart and lung transplants. We talked in the heart classes. There are about 2,500 heart transplants per year. But for cystic fibrosis, one of the treatments is a lung transplant or a heart and lung transplant. So you can see it's not that long that these have been going on. First lung transplants 50 years ago. First heart transplants 30 years ago. So not that long. 1-year survival rate 75%. I don't know any longer term data on that, But if you look at the numbers, only 900 lung transplants per year and 40 to 60 heart-lung transplants compared to the 2,500 of heart. And of course, like everything else, it's the availability of donors. And since some of the kids may be younger, you probably remember this summer hearing about a girl. She was 12 years old and she wanted to get on the list to get adult lungs versus child lungs because there would be better availability of adult lungs for her than to be on a list and wait for a pair of child lungs.